Hey, this is Dr. Simoncini. I'm coming to you live from Southeast Valley Urology. What's one of the hottest topics in urology today? It's treatment of prostate cancer. One of the hottest topics in prostate cancer, not so much in the United States but worldwide, is high-intensity focused ultrasound. Why is that a big topic? I think patients are looking for less and less invasive treatments for prostate cancer with less side effects. Observation, or what's called active surveillance, has been pushed twice now in my career, once in the early 90s and currently once again. Active surveillance is basically doing nothing except monitoring prostate cancer, and it's okay for a few patients. Most of the time what I see is the prostate cancer progresses, and what I saw in the early 90s when they started this was we would take a patient that was curable initially, watch them, their PSA would jump up, we would wind up doing surgery on them at a later date, and then they would need radiation as well to cure them. The cancer was much more advanced by the time we did their surgery. So people are looking for less and less invasive procedures that are efficacious with a lot less side effects, hence HIFU. Okay, HIFU is high-intensity focused ultrasound. It's gaining acceptance worldwide. In the United States, it is FDA approved. It's not part of the American Urologic Association guidelines as of yet. Now, the reason that is in the United States, we generally will need double-blinded, placebo-controlled long-term studies, which HIFU we don't really have. It's been around for many years, mostly out of the country, however, and that's not sufficient for what we consider a plausible study in the United States. Why is it gaining acceptance worldwide? We do see very good cancer control and cure rates, and what's impressive to me, since I do the procedure, is you generally will get very minimal side effects with the procedure. Generally it's a one-time treatment, and we have a probe that goes in the rectum and it directs its therapy at the prostate tissue. It's like when you take a magnifying glass and you're burning an ant or a bug at a distance from the lens. And it's the same concept. Now, the good news is nothing gets affected in between, so there's no damage to the rectum. We monitor for that the whole time. And also, it destroys the prostate cancer cells. We're very precise at how we do this and where we treat each small area. It might take 3 hours, but there's no incisions, no radiation. Generally, when I call my patients the next day to see how they're doing, they'll say something like, what did you do? I don't have any incisions, I don't have any pain, I feel fantastic. And that's generally the way it goes. You generally will have a catheter in for 7 to 10 days afterwards, but other than that, very minimal side effects. So far, at least in my practice, we've seen very good cancer control, very minimal side effects. An excellent way or an alternative way to treat prostate cancer that's efficacious with very few side effects. Thank you.